Hi, I'm Rick Carfagna with the Ohio Chamber of Commerce, and this is the Market Minute. There's no way to put it lightly. Ohio faces a crisis in behavioral health. Out of our state's population of 11.8 million people, nearly 2 million adults in Ohio have a mental health condition. That's more than 4 times the population of Cleveland. Undiagnosed mental illness leads to several terrible outcomes, including other chronic health conditions, the abuse of drugs and/or alcohol, and even suicide. One of our state's biggest problems in this space is the severe shortage of behavioral health professionals. According to Ohio's branch of the National Alliance on Mental Illness, despite the rising demand for services, there is only 1 psychiatrist for every 10,000 Ohioans. It's an even bigger problem for kids, as there are just 11 psychiatrists for every 100,000 Ohio children. This crisis not only tears apart people and their families, it's also disastrous for our workplaces. That's why the Ohio Chamber of Commerce is advocating for 2 important policy measures to improve behavioral health. Last July, the National Suicide Prevention Lifeline began transitioning to the 988 Suicide and Crisis Lifeline. Ohioans who are experiencing a mental health or addiction crisis and their family members can now call, chat, or text the 988 number to reach a trained counselor who can offer help and support. Governor Mike DeWine has pledged $46.5 million in funding over the next 2 years for the 988 Suicide and Crisis Lifeline. And the Chamber supports this budget request because 988 is an important resource for employers and employees and is saving lives every day. The Ohio Chamber is also a huge supporter of both House Bill 97 and Senate Bill 60. These are identical companion bills to create a new licensed healthcare professional called a Certified Mental Health Assistant. This program, spearheaded by the Northwest Ohio Medical University, or NeoMed, would offer prospective students a new pathway to specialize in mental health and substance abuse disorders. This new type of licensure would require a bachelor's degree to get into the program, followed by 2 years of intensive education and clinical training. These assistants would work under the supervision of a physician and would not be able to make a diagnosis, but they would have limited prescribing authority and wholly focused on mental health and addiction. This is an innovative solution to a growing problem, and it's exactly what our state needs to grow its behavioral health workforce. There's plenty more that our state can and must do to address mental illness, but these are 2 big starts. Behavioral health impacts nearly every business in Ohio, and we at the Ohio Chamber believe that investing in mental health and safety is critical to building solid workplaces, a strong workforce, and strong communities. For the Market Minute, I'm Rick Carfagna.